Hello everyone, my name is Gutierrez. I'm going to be talking about ADHD and classroom interventions. This is the presentation overview. We're going to be talking about introduction, significance of the practice problem, the PICO question, the inclusion and exclusion criteria, search strategy, summary of evidence and literature, data-based evaluation, proposed change process, dissemination, and conclusion. So a little bit about myself. I'm a 7th grade history teacher. I work in a Texas middle school. My education, I have a Bachelor's of Science in Nursing. I actually did not pursue a career in nursing. I decided to go a different route. I went through an ACP program and got my certification in 4 to 8 social studies. So I teach history. And I recently, a couple months ago, got my 4 to 8 science certification. So I can also teach science now. I'm obtaining a master's in health science with a specialization in teaching and learning. So I do love healthcare and I love teaching, and so I wanted to combine the two. I hopefully will graduate next August and will be starting the doctorate program soon after that. A little bit about myself. I'm a Christ follower and I'm involved in the student ministry at my home church. My husband Danny and I play in the band. My husband plays electric guitar and I play bass, and I have 2 wonderful dogs, Penny and Milo. So let's get started with the significance of the practice problem. So the reason why I chose ADHD before I go into the definition is I see this condition a lot in my class. Sometimes the students are diagnosed, they go to the doctor and they are diagnosed, and sometimes even though it's not within my scope of practice, I don't go about and tell them, oh, you have ADHD. It's just more like mentally I take note of, okay, this student, even though there's no 504 paperwork that I have to focus on or do evaluations on, I know that this student is exhibiting these symptoms. And so let's talk about ADHD. ADHD is a neurological disorder. It's among children and adolescents, and it affects their academic success and social functioning. And so problems that come with this condition is poor academic outcomes, exclusion from relationships, and disruptive misbehavior. And you see that a lot in class. They want all the attention on them. Sometimes they finish with their assignment very fast, and so they have all this extra time. And so because they cannot stay in their seat, they go ahead and start disrupting others, and they don't stay focused on the task. You also see a lot of these symptoms, or the defining symptoms that go along with this condition, the inattention, hyperactivity, impulsivity. You see that a lot in the classroom, and it is a distraction to themselves, and it's also to the students around them. So the PICO question that we're going to be focusing on is, in students who have ADHD, how does classroom intervention compare to medication-reduced symptoms during a period of a 9-month school year? And so I have a lot of students, in my 3 years of teaching, I've had a lot of students who relied on medication to be able to suppress these ADHD symptoms in order for them to succeed academically, in order for them to stay focused, not get in trouble. And so we're going to be talking about how is it that implementing classroom intervention, how is that compared to the prescribed medication that is given by physicians or is recommended by the counselors or administrators in the school setting. So the inclusion and exclusion criteria, some key terms that were used to go ahead and get started with the search was attention deficit hyperactivity disorder, behavioral therapies, class-wide interventions, drug therapy, and reduced symptoms. And so the inclusion criteria included school-age children and adolescents with ADHD disorder. The articles were peer-reviewed, and it is in the English language. The exclusion criteria, so things that were not included, were the articles that had different languages, articles that focused on university or higher education studies, or articles that talked about alternative interventions. And so it was more focused on the class-wide interventions and their effects, or maybe a comparison of implementing class-wide interventions and how would that be compared to students who had prescribed medication in the classroom. And so here is an image of the search strategy, my Prisma. You can see the different databases that were used. There's about 4 that I mainly focused on. So there was about 998 non-duplicate citations. It was actually it was very, very hard to be able to look through, go through, use the keywords, go through the titles and the abstracts, and to be able to narrow everything. I wasn't going to be using all of those articles, and so I wanted something very specific, very that focused on classroom interventions by the teacher, having to do with the implementation of drug therapy, like a pharmacological treatment, and so excluding all the other stuff that didn't need to be there or did not pertain to the search. And all in all, there was about 8 articles that were included. I know that throughout my journey of going through this PICO question, there was about a couple of articles that I was able to see. It's like, oh, well, it doesn't really fit into exactly what I'm trying to portray with the classroom interventions. And so this is a summary of evidence and literature, all the articles that were used to be able to show about the classroom interventions and the effects it had on the students. And I included this. It's my synthesis matrix, so it includes all the references and the 4 main themes, 4 main ideas that I focused on: the reduction of inappropriate behavior problems and increase of academic success, reduction of symptoms through teacher rating scales, and the correlation of prescribed medication. And so all of this is talking about all the factors that came into play with the implementation of the teacher classroom interventions, and how did that correlate with the medication and what it did to the students. Was there an increase in symptoms? Was there no change? Was there a decrease? And so all of that was displayed in my synthesis matrix. This is the data-based evaluation. So the data collection, I saw that there was a benefit of a mixed method, so a quantitative and qualitative. And the quantitative, the analysis of that was using the chi-square test, and so that focused on the 3-factor symptom. And so you're able to see numerically how is it that these symptoms were improving, not improving, staying the same with the implementation of the classroom interventions. And so qualitative, you're able to see, it's more of the teacher observation. I think there's more freedom in the sense where the teacher could, take down notes and be able to show the raw score and the symptom count. And so it was also used to evaluate the teacher rating data and determine normal values. The criteria was evaluated by the DBD, which was the Disruptive Behavior Scale, and the IRS scale, the Impairment Rating Scale. So these were teacher rating scales that were able to, or that were used to be able to determine the symptoms of these students. And so it was actually a good way to do it would be a 6-week period evaluation. So It would start at the beginning of the year and starting in August, and then it would go on to the end of the year in May. And so within that 9-month school year, you're able to assess it even further during a 6-week period evaluation. So that would be with the implementation of assessments, quizzes, informal evaluations, and so the teachers are able to go further in depth and see how the students are reacting with these classroom interventions. Do you see that they're getting less distracted? Are you seeing that maybe they're getting a little bored with these classroom interventions and it's just increasing these symptoms? So we're going to continue on and talk about the outcomes. And so the outcomes would be the reduction of ADHD symptoms, a reduction of discipline problems in the class, improved academic performance, and improved relationships with teachers and peers. So the proposed change process. So the change model that I focused on was Lewin's change management model. I went through the list of the different models, and I felt this one correlated more with the educational aspect of ADHD and the symptoms and trying to implement this change in classroom interventions. And so the first portion of this change model is the unfreeze stage. And so this one is about letting go of old interventions that were being used. So interventions that just mainly focused on these ADHD students and kind of singled them out from their classmates. And some barriers that are seen during this stage are administrators that don't want to implement these changes because maybe their finance or just it takes too much time and doesn't really fit into their schedule. There's also experienced teachers, maybe it's the administrator that is proposing this change or other teachers, and they're not okay with that. They just want to stick with whatever they have. Even parents as well that don't want this condition to be tied to their child, and so there's a lot of resistance at this stage to move on to the change. The second stage is the change stage. So this is where encouragement is needed for teachers to implement these classroom interventions in order for them to observe the students and their symptoms. So this is where they would use the teacher rating scales. So it would be like a 6-item assessment and checklists, and for them to actually be focusing on these students and observe how they're doing. Is there improvement? Is there not? And so the third stage of this model is the refreezing stage. And so this is the acceptance of change. And so with this, there needs to be an ongoing education over the ADHD disorder and the classroom interventions that are going to be implemented for the school year. And so this would be done through professional development and trainings. The dissemination. This is done at an institutional level first of all. So this would be done through an in-service at school for all teachers despite their grade level or content area. There's many teachers like, oh, that doesn't have to do with me. I don't have ADHD students. Well, they come in starting at the school age. You see them progress, and there's sometimes that there's students that have these symptoms, and so it would benefit all the teachers to be able to go through these trainings and learn about it and how the symptoms would actually maybe decrease with the classroom interventions. Locally, this would be done through a school board meeting at the district level, and then this would there would be a presentation. The district where I work at, there's a lot of school board members that are there to help themselves and gaining more power. And so I think that this would, provide more of the resistance to be able to showcase this change. And so I think that it would take a lot for them to change from their old ways and implement something new for these students. At a regional level, the Attention Deficit Disorder Association is actually held in Houston, the Southern Region Conference, and so presentation of the poster would be great here regionally and nationally through this conference, through this organization. And so I think that would benefit a lot for individuals who have dealt with ADHD, who have researched on it, that can provide data, their own experiences, and to be able to show people, look, this will benefit the student. And this is my conclusion. So I just wanted to say that it really is the teacher's responsibility to be able to implement this, because they are the ones in the classroom, and so the students are there all day, and they interact with several teachers, so it's important for teachers to all kind of be on the same page to implement these classroom interventions, because I think the students won't get as confused, and so there would be a consistency, and it just won't be like, oh, well, this student acts like an angel in one class, but in this other class where the classroom interventions are not there, that's where they get distracted and they start acting up. And so it takes a lot to involve administrators and other teachers and parents, and to be able to use this and to help the students, and for there to be a beneficial outcome. Some recommendations that I would say is to increase the knowledge of ADHD and its symptoms to all of the individuals involved. And I think this would actually help the students' success academically, and relationship-wise with their peers and teachers, and overall confidence. I think that students with this don't feel that they're good enough because they're being labeled with having this condition. So I think it's important to be able to as a teacher, to be able to make a difference in the student's life. I just want to give a big shout out to Dr. Potlog. Thank you so much for your encouragement throughout this whole course. It really was very motivating to be able to get feedback, very constructive feedback throughout all of my competencies, and I really, really appreciate it. And so this is the end of my presentation. Thank you so much.